We are here today speaking with Eva Matuszewski, the CEO of MedNetOne in Rochester, Michigan, for the third in a series of podcasts on the patient-centered medical home. Ms. Matuszewski is one of the state's leading experts on the patient-centered medical home, a timely and fast-growing development aimed at improving primary care and patient health. Let's get started. Eva, the patient-centered medical home introduces several new concepts into primary care, such as self-management programs, group visits, and planned visits. Can you elaborate on these and other programs that are the backbone of the patient-centered medical home?
Absolutely. Some of the concepts in the patient-centered medical home are not necessarily new. They are just new to the mainstream medical consumers. Planned visits, for example, mean just what the term implies. The physician's office has planned and prepared for the patient's visit and already scheduled necessary tests and blood work way in advance of the visit. This allows for a more productive and efficient visit between the physician and the patient with much less follow-up. All of the programs advocated by the patient-centered medical home have been successfully tested in various parts of the country, including Johns Hopkins, Kaiser Permanente, and Duke University. The overarching philosophy in these programs is that patients take on a more active role in their own health care.
Eva, how is that new? Haven't individuals always been responsible for their own health?
Well, historically, when consumers seek out medical care, it has often been with the assumption that the physician would cure everything that ails them by a prescription, surgery, or that quick pill. However, chronic illnesses like type 2 diabetes, asthma, heart disease, depression, and obesity, which are so prevalent today, can't always be treated solely with pills or surgery. They need to be managed or co-managed over the long term to maximize one's health, and proper management requires the physician and the patient and even the patient's extended family working together.
So that's where the term self-management comes from.
Yes. The PCMH is geared to primary care, and many primary care physicians have practices where a large percentage of their patients have a chronic illness. When the patient self-manages his or her own care in tandem with a physician, the health outcome is markedly better. For example, type 2 diabetics need to reduce their weight or maintain their weight at a healthy level. The physician cannot do this for them, although he can provide some tools. Ultimately, though, the patient must self-manage his diabetes, weight level, etc. This also applies to smoking cessation. While the physician can urge a patient to quit smoking, the patient must self-manage the smoking cessation process with the guidance of qualified professionals. He needs to decide what that action plan is going to be, and in concert with his physician and clinician decide how apt he will be to attain the goal and what steps he or she will take to attain that goal.
Self-management certainly seems like a lot of responsibility for the patient. How do they not get discouraged?
Self-management programs actually provide more tools in the form of allied health professionals than traditional medicine does, so the patient is never on a solo journey. For example, the patient-centered medical home offers group visits where patients and their families with similar illnesses meet as a group with a medical professional serving as a facilitator to discuss tactics and strategies for staying well. There is a program called the Stanford Self-Management Workshop designed by medical pros from Stanford University, Dr. Kate Lorick, for example, that walks people through a variety of strategies and tips for successfully managing a chronic illness. MedNetOne has also designed an award-winning approach called the Chronic Care Travel Team that complements the patient-centered medical home.
Eva, what do you mean when you say the Chronic Care Travel Team complements the patient-centered medical home? Is that another self-management program that you were referring to earlier?
Well, MedNetOne's Chronic Care Travel Team is a multidisciplinary team of healthcare specialists, including a registered nurse, certified diabetes educator, registered dietitian, wellness coach, wellness counselor, exercise specialist, that combines their expertise to provide a range of support services not only to chronically ill patients, but also those seeking direction in prevention areas in the primary care physician's office rather than in a hospital. Working as a team and in tandem with the physician and the physician's office staff, the chronic care travel team evaluates and provides counseling to patients with one or more of the 6 targeted chronic diseases. Currently, the diseases that we target are diabetes, asthma, obesity, congestive heart failure, coronary heart disease, depression, and lower back pain. What we've also done is incorporated these diagnoses and these services into pediatricians' practices. In the past, chronic conditions were only addressed or attacked at the adult medicine level, and we are seeing an increased incidence in chronic conditions affecting the younger population under the age of 18.
But chronic illness just doesn't go away. So how much change can the chronic care travel team make with someone who's chronically ill?
Well, you are absolutely correct. While there are some exceptions like obesity and depression, chronic illness generally does not go away. But with effective and practical self-management tools and skills, the outcomes of a chronic illness can be improved. When a diagnosis of chronic illness is made, a patient may easily be overwhelmed not only by the reality of the diagnosis, but by the list of do's and don'ts that accompany it. Accordingly, the patient may do nothing, leading to a worsening of the condition.
So that's where the chronic care travel team comes in.
Yes, precisely. The chronic care travel team recognizes that only changed behaviors can change outcomes. Typically, it takes at least 3 months of behavior change before outcomes can be changed. The chronic care travel team does not try to change the patient's behavior. That doesn't work. Instead, the chronic care travel team empowers patients to make positive changes, treating each individual patient uniquely and offering tools for the patient to better self-manage their chronic conditions. The chronic care travel team monitors the behavior change, while the patient's physician and the physician's clinical staff monitor the outcomes. Working together, the ultimate goal is increased self-management of the chronic illness with a significant reduction in chronic illness health risks such as fatigue, depression, eye disease, organ failure, and even in certain instances, amputations.
So Eva, what came first, the chronic care travel team or the patient-centered medical home?
The chronic care travel team's holistic approach follows the philosophy of and sets the stage for a primary care physician to establish his or her practice as a patient-centered medical home. The patient-centered medical home concept was actually started in the 1960s by the American Academy of Pediatrics with a focal point being Chicago, Illinois. The chronic care travel team is new and was created in response to the growing number of patients in the U.S. with chronic illness. The chronic care travel team is one of the tools that can help the patient-centered medical home succeed, and that chronic care travel team is simply indigenous to the culture of Medical Network One.
Thanks, Eva, for sharing with us the programs of the Patient-Centered Medical Home.